Hi, everyone. My name is Aoife Earls, and I have been a practicing naturopathic doctor here in Ontario, Canada, for the last 16 years. My journey and how I got into healthcare was very personally driven, and I have to say, initially, it was partially because I wanted to help, but partially because I wanted to get myself better. I had been struggling with severe eczema or atopic dermatitis. For those of you who are not aware, that condition is just extremely itchy skin that is driven by allergy. And when I was 21, it had reached a peak where a dermatologist I was seeing at the time was talking about doing chemotherapy with me because they didn't have things like biologics at the time to suppress the immune system. At that time, I was doing a master's in neuroscience, looking at the mind and body connection. And I started doing a lot of my own research into some of the things that could trigger immunity and had sort of like a heart to heart with myself and realized I was probably celiac and was having trouble digesting gluten. I'm Irish, and in genetics, Irish populations with Italian populations are actually the highest celiac percentage in the world. And there is a component of celiac disease known as dermatitis herpetiformis, where basically you get these like little, very, very itchy blisters that are triggered by gluten exposure. So I thought, okay, what do I have to lose? And I cut myself off of gluten for a couple of weeks and noticed that my skin swelling started to decrease pretty rapidly. Of course, at the time, everybody thought it was in my head and I was crazy. And so I started, seeing the difference between when I ate gluten and when I did not. And I noticed a huge difference in my skin. So that was the beginning of me exploring my own journey. But because my skin was so damaged, and there are many, many other things that can contribute to inflammation, I realized that it was going to be quite the journey in figuring that out. Now, because my skin had been such an issue in my teens, it had really affected my self esteem. And I started looking into my mental emotional health at the time. I started seeing therapists. I started realizing that my coping mechanisms for stress were pretty poor. And there was a lot of things that I needed to do to sort of support myself. So I enrolled in naturopathic medicine to see if I could heal myself. I remember a supervisor when I was in my first year telling me likely by the time I finished the program, my skin would be healed. And I allowed her to hold that hope for me because I had had it such a long time. I didn't have that kind of faith, but I was open to it. And so she was right. By the end of my 4 years, it was like 80% healed. And then I started working on it myself. And then when I got into practice of naturopathic medicine, I started recognizing patients and their blocks to either accepting physical support were coming from their mental emotional well-being. I started exploring things in therapy. I started looking into mindfulness meditation to help my patients, of course, realizing it was helping myself. And then I started looking into spirituality. How does the soul and the emotion influence the body? And so I started looking at them through shamanism. I did training in mediumship. I looked at medical intuition because of so many things I was seeing in practice that I couldn't explain and I wanted to be able to explain. And so over time, my practice started to become a lot more full focus than just what's happening in the body and what treatment can we use. And then after my son was born, there was an understanding within me that realized, treating the whole person is really what I should have been doing from the beginning. And really being able to integrate that into my practice started shifting the way I practice. So I started looking at grief and depression and burnout. And I started incorporating some of those understandings into my practice, and my practice really started to shift. And so I would say now my practice is firmly still very scientific. I still do a ton of exploring blood work through labs and physical practice, but I also really integrate nervous system healing in my practice. I do talk about spirituality with my patients when they're open to that. And I do really feel that so much of what we can do to influence our health is belief that we can support ourselves. So I've come a long way in that 16 years in sort of integrating the body, mind, and soul, if you believe in a soul or the self. And that is what I'm here to offer, is sort of the wholeness of what I do in my patient work, but also in my teaching work. So in the last like 5 to 10 years, I've been lecturing a lot on burnout, how we can bring mindfulness into our daily life, how grief impacts the body, how burnout impacts the body, how we use intuition to support our parenting and our life, how we conserve energy when we're healing from traumatic events. And so those are my strengths. So if you're in the province of Ontario in Canada, I can do physical work with you, and I can do virtual work with patients who live in the province of Ontario. For everyone else, everywhere else, I'm going to be more of a teacher and a mentor, where we're learning together in a teaching capacity and help you to figure out how to help yourself. So I look forward to meeting you and working with you.